to welcome Dr. Nadia Dowshen to come and speak with us this afternoon. Nadia, just to give you a little bit of background, Nadia completed her undergraduate and medical school training at University of Pennsylvania, where we first met, and that was followed by residency at CHOP. She then completed not one, but two fellowships, one in academic pediatrics at Lurie Children's, followed by Adolescent Medicine Fellowship at Children's Hospital of Philadelphia. She's now remained as faculty at CHOP and is the founder of the Gender and Sexuality Clinic there, as well as the medical director of the Adolescent HIV program. A lot of her NIH and CDC-funded research involves using mHealth technology to care for HIV-infected youth. So please join me in welcoming Dr. Nadia Dowshen.
So today I want to talk a little bit, for those of you who might be less familiar, about what's going on with the HIV epidemic in adolescents and young adults in the U.S., to talk about some evidence-based digital health interventions that are out there and being worked on, and to sort of think about how we can apply the concept that we've learned from digital health interventions with adolescents living with HIV to use with other chronic diseases and well-being in general. So despite the fact that the majority of the burden of HIV is not in the United States in the world, when you look at certain populations of folks in the U.S., we still do have a crisis and a major epidemic. We still have over 1 million people in the U.S. living with HIV and approximately almost 40,000 infections each year. And despite the fact that adolescents and young adults make up less than a quarter of the total U.S. population, they account for almost half of new infections. And despite the fact that the CDC has been recommending routine HIV screening among adolescents since 2006, we've seen very little change. Pediatricians are really doing a pretty poor job of making sure that adolescents get tested. And so even after, more than 10 years later, still only 1 in 4 sexually active adolescents report ever being tested by their providers for HIV. And for those of you who are not familiar, this is called the HIV Continuum of Care. And so we have a certain number of folks who are living in the U.S. with HIV infection, which you see all the way here on the left, a certain number of those folks who've been tested and diagnosed, then a certain number who have been linked to care, retained in care, going to their appointments, prescribed antiretroviral medications, and achieved suppressed viral load, which is the goal of HIV therapy. And these numbers are a little bit old now, but what you can see here still applies, that we're doing really poorly in the U.S. in general for all the resources that we do have, and that youth are doing sort of way worse all across the continuum when compared to their adult counterparts. I think it's also important to note that there is a huge disparity in terms of who within the U.S. is becoming infected with HIV. And the CDC recently came out with a statistic that 1 in 2 Black, gay, and bisexual men will become infected with HIV in their lifetime. We don't have the similar numbers for transgender individuals, specifically for transgender women, who are very disproportionately affected by HIV because gender identity information often isn't collected. And now we're starting to do better with that. But what we do know is that in general, trans women are 50 times more likely to become infected with HIV than the average person, and that about 1 in 4 transgender women of color in the U.S. are already living with HIV in their 20s. So we have major disparities in the U.S. in terms of who's impacted. So when I I started doing HIV care over 10 years ago now, wow, that makes me feel old, when I was meeting my patients and telling them that they had to, learn to start taking this medication every day at the same time, and having this really serious conversation, they would just be kind of ignoring me and texting on their phone. And so that's how I got inspired into this line of research. I was like, okay, well, if these young people are on these things all the time, then we've got to use them to help empower them to take care of their health. So, I don't need to tell you how much these days all people are using technology, but especially young people who are usually the first adopters of it. I think one of the other things that really appealed to me about the technology was that I would see my patients about every 3 months for their, medical follow-up visits, and, I'd say, how are you doing with taking your HIV medicine? How many doses did you miss in the last month? And they said, oh, Dr. Dowshen, I was doing really great until about a month ago when my insurance got turned off, or I started having an issue with substance use, and so now I haven't really been taking it since then. And I thought to myself, well, oftentimes we're finding out this information when it's too late to really be acting on it. And so one of the advantages of the technology is that because they're using it all the time, we can also use it to stay in touch with them all the time and try to get information from them and intervene in real time. So what are the different types of interventions that have been used for trying to improve adherence in HIV? So there are things like directly observed therapy, which is the idea of, just giving somebody their medication and watching them take that. That works really well, while you're doing directly observed therapy, but it also costs a lot of money, and it uses a lot of resources. And we also know that as soon as DOT stops, it doesn't really improve adherence in the long run. There are things like, what's happening there? Regular counseling, phone call reminders, and then my earliest work in my fellowship project was looking at text messaging reminders. So to text young people a message that they designed, reminding them at the time they wanted to be reminded to take their medication, and they would text back to say whether they had taken their medicine or not. And we showed that some success with that in terms of improvement in self-reported adherence, and a trend in this pilot study towards improvement of viral loads. And then my mentor, Rob Garofalo in Chicago, went on to then get more NIH funding, and in a randomized controlled trial showed that this intervention worked, and it became one of our CDC evidence-based interventions. So after that, I was really interested in how could we take, what we learned about what worked with text messaging and expand that to really interact with youth more, to try to engage them in care more broadly, and to make other methods of hopefully gaining on their adherence improvement. So I was lucky enough to be funded for an NIH Career Development Award. Sorry, I don't know why this keeps moving forward without me. And also a HRSA Special Program of National Significance grant to develop and test an app to try to gain on what we had been working on previously. So the aims of our study were to understand the frequency and patterns of mobile phone use among youth living with HIV and determine their preferences for an app to improve adherence, to determine the feasibility, acceptability, and the preliminary efficacy of this intervention, and to explore the relationship between how much somebody and how somebody is using the app and what the outcomes of interest are. So we began the development for the Treat Yourself app many years ago, and I was lucky to first be able to get help for free from undergraduate computer science students through a course that I took at Penn. But from the beginning, we had this idea in mind that we wanted to, guide the intervention using theories, including a traditional health behavior model theory, the integrated model of behavior prediction, And then this idea of ecologic momentary assessment and intervention, which is this idea that I talked about previously, that when people are going about their it's just a fancy way of saying, as people are going out their real daily lives, can we intervene or make assessments at that time? And then also this idea of, we didn't think that just texting somebody or having somebody use an app, if there wasn't somebody on the other end who they felt accountable to and who cared about them, like their care provider or their partner or their friend, that it probably wouldn't work as well if they didn't have that sense of supportive accountability. So we put together a multidisciplinary team that included game app designers and user interface designers from Drexel University, which is next door to us up at CHOP and Penn, and myself and our study team, which included a young adult who was living with HIV, who was part of all of that weekly process. And then we took an iterative approach, which was youth-centered, and had a series of focus groups in addition to that one person who was part of the entire process, a series of focus groups in the beginning to understand how youth use technology and what they might want in an app, and then later actually having them play with the app and give us feedback, which we call usability testing. So for our focus groups, we did computer-assisted self-interviews to learn about the mobile health use. We showed them some of the wireframes that I had made up in this course that I took, and then did nominal group technique with them to try to elicit what would be the key features that they would want to prioritize. And so you can see here the demographics of our focus groups, which really reflect the patients that we're seeing in our clinic and who's being most affected by HIV in the U.S. right now. So I just want to draw your attention to some of our findings for how youth are using the technology. At the time when we did these focus groups now several years ago, the majority were Android users, and I would say since then I think that's switched to them being iPhone users, and just tells you how quickly things change with technology. And then you'll see here that most of the youth were on their smartphones almost 14 hours a day. If you think about it, that's like basically the entire time that you're awake. And so that was something that we were pretty impressed and blown away by. Also, most folks, despite these being young people who are quite economically marginalized, who might be homeless, who might not always know when they're going to get their next meal, they all had phones and they all had pretty good access to Wi-Fi as well. The one thing, though, that I think is really important for this type of research is that many of them were having disruptions in their plans and services, in losing their devices or getting them stolen or taken away. So that's definitely something that we've had to really keep in mind. So when we ask young people about what features of the app would be most helpful to them, the focus groups had a little bit of differing opinion, but some of the features that they thought were the same. And so sort of based on that ranking and then decisions about money really dictated how we could go about developing the app. So certain of the features that the youth might have really wanted would be very intensive and time-intensive and expensive to develop, so we had to make some decisions there.
What is the panic book?
Oh, yeah. So the youth in both focus groups talked about wanting some way to just sort of say that they were panicking and to get in touch with somebody that they knew cared about them and who could help them. And so we ended up taking this idea, and because of the themes that we found through our usability testing, deciding to rename it something else, because panic doesn't sound like a great thing to me. But so one of the things that they liked about when we actually showed them the app that we had developed during the usability testing, they really liked the fact that it was very positive, that people weren't putting each other down or weren't getting sort of negative feedback if they weren't doing well, but rather getting positive feedback when they were doing well. And so they would tell us that they thought some of the things in the app were like corny or cheesy, but they actually really liked that it was positive. So that's one of the reasons why we took that panic button idea, but then made it into something more positive, which I'll show you. I'm getting feedback all of that. Okay. So one of the other things that was really interesting to us was that, in the world of HIV care, we worry very much about our patients' privacy because unfortunately, HIV is probably the only chronic disease left in the United States where you could go home and tell people that you had it and that you might not get unconditional love and support, and there's still so much stigma. So we holds really carefully the idea of wanting to protect a patient's confidentiality and not disclose their diagnosis accidentally. So we were really concerned about whether the youth would worry about having this app on their phone and privacy issues. They actually were not that concerned about privacy. And I think that this just goes to show how when folks are growing up in a generation with apps and social media and all of these things, they're thinking about those issues a lot less. And I think they told us that one of the ways that we could also get around it was to keep the content and the things that would appear, on their phone to a random person, just looking very neutral. And then they would say things like, oh, it's my app for like logging my jogging, or whatever. They also really liked the idea of having some kind of healthy competition where they could sort of protect and support each other through that. So as I mentioned, sort of initially started out doing this when I didn't have any funding, and it took time before getting funding to see a little bit of the progress here of how the app got more sophisticated with support. And then now we're here with an app that's called Treat Yourself. And just in terms of the name of the app, we decided that we wanted the youth to come up with the name for the app, but one of the young adults on our app development team actually thought of this idea of Treat Yourself. And so we brought, and I don't know if you all are familiar with the show Parks and Recreation, a reference to that. And I think has a nice kind of double meaning in this case. It's just kind of like about, taking care of yourself and loving yourself and also taking your treatment or your medication. And so when we brought that to the group, youth just loved it, and so they decided that's what they wanted the name to be. So this is the current version of the app. And so what you see here in the middle is the home screen, and you'll see in this left quadrant here, this is where the youth will get their reminders set to when they want to, and also gives them an idea of how much time they have until they're supposed to take their medication. And then they're able to indicate whether they would have already taken their medication by the checkbox, and then if they didn't take their medication, and then also it's not appearing well here, but there's also a snooze button so that they can get reminded later if they can't take medication at the time. Now, on the right here, you see our avatars, which are customizable, and you also notice that there was quite an evolution between what the avatar looked like originally and what it looks like now, and that was based on the youth feedback that they really wanted the avatar to look like the Kim Kardashian app. So you notice here that like the more sideways, and they have the shadow, and that's all like part of apparently the Kim Kardashian app. So we obliged, and they can pick avatars with different skin tone and eye color and hair styles and things like that. And then in the lower quadrants here on the left, you'll see the calendar, which helps to keep track of medication. So one of the things is when I would ask, my patients about how many times they missed or their medications or when they were failing to take them, they would tell me like, I don't know, I wish I had a way to keep track of that. So that's why we put in this calendar, and so they could see just here. Oops, sorry. They can see just here in the last several days, or here they can see a whole month view of how they were doing with taking their medication. And then this is our leaderboard here, and this is just what it looks like now. So young people will get points for taking their medications, and the more days in a row that they take their medications, the more points accumulate. And that's resets every month so that people who were, winning one month wouldn't always be the ones to win forever. And so they could get, sort of gold, silver, or bronze if they're in first, second, or third place. They were also able to give each other kudos or thumbs up to encourage each other. And then also, again, you'll notice this was the app icon that the youth chose among a couple different options, which I think looks like a crown. And, when they're treating themselves royally. But it's also something that's very neutral, and nobody would know that it's an HIV app. Yeah.
Did any of the patients know each other, or is this just completely anonymous?
So that's a great question. So, one of the ideas behind this was that I wanted to have a place where you could engage with each other without their identities being revealed, because there is still so much stigma against HIV. We have a lot of young people in our clinic who do not want to participate in an in-person support group. So this allows them to have an avatar, and then they're instructed to choose a screen name that doesn't have anything relating to their actual name. So they can get support from other young people who are going through the exact same thing as them without having to disclose their diagnosis. Great question. So one of the also newer features that we just recently rolled out is smart reminders, which are this idea of, yes, you can get reminded based on the time that you take your medication, which is pretty standard, but then we could also do a smart reminder where you could do it based on location. So let's say, you're interested in taking your medication every day when you get to work, but it might be a slightly different time every day. So you could put in the location of where you work. This is our new research building at CHOP. And then you can use the location. And then you can also have a time-based reminder as well, so that whichever one is relevant will go off first. So if you end up getting to work before the time you need to take your medication, it'll go off then. But if you haven't gotten there yet, it'll go off at the time that you're scheduled. And then just, again, to emphasize that we're sort of doing a variety of different delivery methods of messages. So we have our sort of traditional text messaging and push notifications for the reminders. We have these discussion forums, which is something that I didn't show on the other schematic, but so we'll have different topics that are relevant to young people who are living with HIV, like PrEP. And these forums will also be moderated by our research assistants who are in that as well. And then there's also in the menu a link to all different kinds of resources that youth who are positive might need. And then this is a little old school here, but we do, when we gave out the app to youth to put on their phones, we also give them this paper quick start guide that they can fold up to this size. And despite it being old school and not technologically based, they actually liked having that. And then this is just a picture of what the back end of the app looks like, so how we can organize the data that we're getting from the app. So as I mentioned, I was fortunate enough to get an NIH Career Development Award, and then through HRSA special programs of national significance, we were one of 10 sites across the country chosen for a social media initiative to try to engage and retain HIV-positive adolescents and young adults in care. And so we partnered together with our community-based organization in Philadelphia that serves primarily adults, but many young adults as well, called Philadelphia Fight. And they had actually developed their own technology-based intervention called Amplify Your Health, which is a digital literacy workshop. And then I'll talk to you a little bit more also about our I Know You Should Too HIV and STI awareness campaign, and together with the Treat Yourself app. And so we proposed for this demonstration project to use these three interventions in combination to try to improve engagement in care and adherence. for youth living with HIV. So here you can see what our different study measures are. On the left, the different demographic information and behavioral scales that we collected, and then on the right, the different medical data that we were abstracting at baseline and throughout, as well as what we're collecting in terms of back-end data so that we could really look at how use of the app correlated with outcomes. So for this project, we were actually able to enroll adolescents and young adults up to age 34, and anybody who was newly starting HIV medication or was having difficulty taking their meds, who was basically anybody who was not virally suppressed, or who had been out of care for more than 6 months in the last 2 years. And so for this, we're not doing a randomized controlled trial, but rather a pre-post design with comparison to historical controls and looking at some other secondary outcomes like incident STI infections and retention in care. So here you'll see we are, recently past the point of having all of our youth completed their 3-month visits, but overall we enrolled just over, these data are slightly old now, we enrolled just over 50 youth, and you'll see the mean age here was around 25, and for young people of color who were assigned male sex at birth, reflecting again what the patients who are in our clinic and who was being most affected by HIV. So a number of the individuals were already on antiretroviral therapy. Interestingly, as I mentioned, we thought that because we were only able to develop the app for Android, but HRSA did give us some funding to be able to buy Android phones for anybody who had an iOS phone if they wanted to participate and qualify. And it turned out that we ended up buying quite a few phones. So more kids had iPhones now than what we had anticipated a few years ago. And you'll see that there's high rates of unemployment and relatively low education levels and a number of folks who are struggling with their housing situation. So again, as I mentioned, some more iOS ownership than we expected. Also, a number of kids who didn't have a phone, and we were able to provide them with one for the study. Again, very high rates of how much time youth are spending on their phones and good access to care. Again, more than half were having some disruption of their phone within the last year. So when we asked about their satisfaction with the Amplify Your Health workshop to give them skills about digital health literacy in general, and particularly to orient them to the app, youth were happy with that. The one major thing that they didn't like was that they were being talked to about certain features of the app that weren't available initially. And so one of the major challenges that we had was that app developers don't necessarily work on the same timeline that we need our research to be done in. So we had to actually roll out the app before all of the features were ready. So in some ways, I think that was a plus, though, because then we could roll out new content that would get people excited and engaged as time went on. And so in terms of the app features, you seem to find most of them helpful. They really liked the medication reminders, the tracking, and then as we were talking about before with the panic button, instead we did this daily reminders. Most would prefer this in addition to usual care and would like to continue it beyond the study if it was possible. And they thought that it was really helpful to see how they were doing with taking their meds. So, again, most folks felt that they were getting most of their messages. Some did find the messages to be bothersome. And these things are, the fact that they didn't all read all of their messages and that some of them found it bothersome is not surprising to me. And we're kind of seeing with the other demonstration sites in the HRSA initiative and from other health studies that, engagement with these types of interventions after a month is usually around 40%. So you're not going to, reach everybody with these interventions. So I think that this is kind of in line with what we would expect. Folks did feel like it respected their privacy, and that it might have helped them to miss their medication less often. And in terms of digital health literacy, we did also see a trend towards improvement in their health of literacy. In terms of risk behaviors, and I'll also show you results related to sexually transmitted infections, which we measure every 3 months as part of clinical care. In this realm, we did not see much of any improvements at all. Also not totally surprising. Most of what we're talking about in the app is related to sort of general health and well-being and to medication adherence. But obviously this is an outcome that we care about as well. And then sort of so far for what we have from the 3 months data, we are seeing a trend towards improvement with viral load, and we are seeing statistically significant difference in self-reported adherence. So that's encouraging, and more to come. And I also just want to spend a few minutes talking about a couple of other interventions besides Treat Yourself that we're working on. So really lucky to be one of the partners along with the Children's National Team for an R01 that's in Philadelphia, Baltimore, and DC, which is being run by our colleague and friend Renata Arrington-Saunders. And we are, this study called PUSH is aiming to enroll several hundred HIV-positive and HIV-negative youth across the 3 cities using respondent-driven sampling. And these, again, are African-American and Latino young men who have sex with men and trans women in the 3 cities. And so we're doing a randomized controlled trial for both HIV-positive and HIV-negative youth, adapting a motivational interviewing case management intervention with some of the features from our Treat Yourself app. And so the asset that has been developed for that study is called MEI Coach. And so you can see some of the features of the app here and some of the things that are similar. The main difference here is that the coach, the health coach, is really the center of the app, and so communicating with the young people through video chat in the app is the main feature, but some of the other things in terms of progress, and then COCAM was also one of the ones that we weren't able to roll out in our app, but we have now, which is where you can just take a picture to show that you took your meds instead of pressing a button, but also the chat function that we had in our app as well. So we're actively enrolling in that study now in the 3 cities, and so far it seems like we're having sort of similar levels of engagement with this app, which gets at slightly different ways of trying to improve adherence and engagement. Then also just wanted to quickly talk about the I Know You Should Too campaign, which is a campaign using social media and traditional media and community-based events to try to improve awareness of HIV and STI testing and improved rates of testing among adolescents in Philadelphia. This was an initiative that our hospital, community, and government affairs group decided to co-sponsor with us because they were concerned about the fact that we had high rates of gonorrhea among 15 to 19-year-olds in Philadelphia. And so we started with a variety of ways of introducing the campaign, and you'll see on the right here, a big part of it was having youth being involved in all aspects of developing the materials and all of the pictures and everything. The main part of the campaign is a website, so there's a desktop version and a mobile optimized version of the website where folks can go and they can get information about what STDs are, why they should care, our testing locator. And then we had a refresh of the campaign in the last year or two, and this is what it looks like now, to just be up with the time. And then when we think about the different functions of the campaign, we did some research to analyze how youth were using the app, and actually folks were spending the most time on the website on this page, which I find really encouraging, which is they could put in their address or a zip code of an area where they wanted to get tested, and it would tell them places where they could get tested for free and confidentially. And then also the most recent addition to the campaign is new content about PrEP. And so then we were able to add on to the locator function that we had for testing. Now folks could also find a PrEP provider that we have vetted that would be supportive for adolescents and young adults. So after all the stuff that I've been working on, I really want other folks to learn from all of my mistakes in this work. So I thought I'd share a few of the lessons that I've learned. So I mean, I think one thing is apps, text, tweets, they won't necessarily work for everyone, but I think that they're a good addition to other types of clinical care and interventions. We know that on average, folks are getting about 40% engagement. And that we have to think about whether smaller gains in adherence and engagement in care are worth the kind of cost and the intensive nature of some of these types of interventions. I think you really have to consider carefully what kind of technology is really needed for the intervention that you want to do. Do you need an app? Would it be easier or better to just do a mobile website, which it takes a lot less to develop, but you can't do as much of the graphics, for example, that we have in our native app. Or can you just do it by text messaging, because that would be the cheapest? Or do you want to really be taking full advantage of that idea of supportive accountability and having an e-coach like we do in the PUSH study? And then also thinking about, do you want to use an off-the-shelf existing platform that's already out there? From a company that's been already vetted by other folks, or are you trying to create something that's totally new? And then, from my experience as well, I think it's really important to, when I went into medicine, I didn't, and when I wrote my K awards, one of the criticisms was, oh, Dr. Dowshen didn't talk about getting training to develop the app herself. Well, I didn't go into medicine to do that, but it's really important that you understand different aspects of technology and are able to work with people who understand that and can help you to negotiate the business aspects of those types of relationships, and thinking about intellectual property and things like that, which I never thought would be a consideration when I first started doing this work. As I mentioned several times, you really have to, if you're working with youth who are marginalized, think about the fact that they will have disruptions in their technology and plan so that you can easily re-upload the app or log in to the website or whatever it is that you're doing. I think some of the other big issues that we're thinking about more generally for youth, sort of regardless of their chronic disease or if it's for general health and well-being. We've developed this CHOP M Health Research Affinity Group And we're really thinking about issues about sustainability and cost and how, if these interventions are successful, are we really going to integrate them into care. So I'll just end there. And I'd like to thank, first and foremost, the young people who inspire this work, and all of my mentors and collaborators and colleagues and funders. And I'm happy to take questions. These are my 5 and 8-year-olds who probably can answer your questions better than I can about the technology. So, thanks.
Hi, I'm actually one of the social workers for the SIS Searches team in Management. I was wondering, do you know of any way we could do like an app rather than regular texting, because I feel like a lot of these kids, you might call them and they don't answer you, and then they're like, text me, and then is there any HIPAA regulated texting that you might tell them, do not put your name, don't tell me about your medication, all that stuff, but you know, these are teenagers and young adults, and they might be like, hey, I'm out of my desk of me, and do you know of any way that we could utilize this app for like a messaging system that's completely anonymous?
Yeah, so it's a great question, and how you actually implement sort of texting between patients and providers in actual clinical care really differs depending on your institution, because some places have policies that you can only use certain types of platforms or that you can't do it at all. We've actually implemented, I would say, probably like 8 years ago now, texting. So our social workers in our HIV clinic text patients for their appointment reminders to communicate with them in other ways, because often they will not pick up their phone, but they will respond to a text. So we've been lucky that we've been able to clear that through just using regular text messaging. We do, of course, talk with our patients a lot about privacy and confidentiality, and we never send anything to them in a text message that would, in any way disclose their diagnosis, but we encourage them to think, for themselves about that too. And so far, we thankfully have not had any issues with that. But I know that other institutions who are part of the HRSA social media initiative have tried to implement texting the same way that we have, and have really run into a lot of barriers with the hospital administration about whether it was allowable or not. So I think it's something that's worth looking into, or just doing it, and ask for forgiveness later.
Never ask a question you don't want to hear the answer to.
Yeah. And then you also, if you do get in trouble, you can always point to the fact that X, Y, and Z other institutions are doing this. So maybe that will help.
They carry a little picture of you, so we
She does. It's her fault. It's all her fault.
With the scores, there was no incentive associated with those, was there? It was just kind of for own pride, right?
Yeah, so there were sort of the leaderboard with the medals, so you would get that medal if you were in the first, second, or third place.
Have you not discussed using incentives?
Yeah, so I have like a lot of mixed feelings about the whole idea of using behavioral economics and incentives in marginalized adolescents. I think there are places where it could be appropriate. We decided that we did not want to use any kind of monetary incentives. This was one of the features that we weren't able to roll out due to budget limitations, but one of our original hopes was that when you got a certain number of points, you could buy new hair or new jewelry for your avatar, or things that folks might want, so that it was another way of rewarding people that wasn't necessarily using money. But certainly many people are integrating behavioral economics into their interventions, and so I'm working with another one of the folks at CHOP who's doing stuff on smoking cessation for adolescents in primary care, and he is using this way to health system that we have through Penn that has mostly been used in the past for adults to provide financial incentives for adherence to a particular behavior. That's a situation where I think it might actually make more sense when you're trying to get somebody to give them incentives to form or unform a specific habit in that short period of time. For medication adherence, and for young, in the context of the other issues that young people who are living with HIV are facing, I have questions about the ethics of doing that.
You referred to the cost of this. I was just wondering if you could, I'm just curious, like, if your app is successful, what are some of the costs, ballparky, for this? And have you been exploring who might be interested in, are pharma companies interested in using these, like, financing these apps? And, because there must be, like, ongoing, to constantly upgrade stuff like that.
Yeah, so this is, like, a huge issue, and there are now so many people doing research in this area and so many different apps and health interventions in general that are being developed. First of all, we don't know yet if most of them actually work or not. Like the only one that I know that's really been proven and like a large RCT is just straight up text messaging. So I think that soon we're going to have a lot more evidence about what really does work and doesn't, but then there's huge questions about sustainability and depending on how much they are really helping, is it going to be worth the cost of sustainability, and who will be the audiences to financially support the work going forward. So I think pharma companies is certainly an option, and we are considering that. I haven't decided if I myself want to take any pharma money, but if it means sustaining the app, I might consider it. I think the other market that we should really be looking at and working with are the insurance companies, right? Because if people are doing better, whatever chronic disease it is, with taking their medications and their healthcare costs are decreased, that's a benefit, right, to the insurance company. So I certainly think we should be thinking about that market. I think in the HIV world, we're also looking to organizations, sort of like our local health department and the state health departments that have HRSA HIV funding. And right now we have interest from the sort of the funds that go towards our AIDS drug assistance program in our state. Our funds are pretty robust in Pennsylvania. And so they're considering maybe giving some, because everybody's actually getting meds who needs them, and they have money left over that they might be willing to give us some money to help sustain the app. And then, of course, there's always more grants and things like that, which I'm applying for a PCORI grant right now to try to further sustain some of this work. But I think that it's a huge issue and will be a challenge over the next many years.
What about the hospital? Has the hospital shown any interest in investment in kind of taking this on?
So one of the things that
taking part in clinical care?
Yeah. So one of the things I also learned in this process was that I didn't understand like all of the different technology needs to make something like this sustainable. And when we were first going through the process of developing the app, I didn't realize that there would potentially be a different institution that would host the app than that would be the developers of the app. And so the app is actually on CHOP servers. Now, CHOP, other than maintaining the server, is not really doing anything to support the app other than that. But because the developers from Drexel are the ones who are doing all the actual programming of the app. But because it is on the server and they have made that investment, there are efforts through the CHOP digital health initiative to take a number of successful health interventions and really try to integrate them into clinical care. So I'm hoping that they will be interested in supporting it as well. It's a little bit complicated though because it was not developed in-house, But I think that this is an issue that many hospitals have that they don't necessarily have in-house app developers and need to contract out for that. So then, again, that's where you have to really think about the cost and sustainability issues.
You said on the app that the heart button, that will send a message to whoever they want, like either a friend or a provider. Is it a possibility to utilize that as like if they wanted or had a question about their medication or they were running low, could they like send that heart to their social worker?
Yep, that's exactly partly what it's for. So yeah, this is
So it's still anonymous, but the social worker would know this is associated with so-and-so.
Yeah, so the heart contact, if they press on that button, a screen comes up that looks like this here on the left. So they can put in whoever they want from who's like a provider, social worker, nurse, doctor from their clinic, or one of their friends or family members, and then they can press the button to automatically text or call them about whatever it is they want. That could include like, I need my meds.
So does the message go through the app, or is it like a separate text?
No, so this is a separate text.
Okay.
So it will go to whoever's phone number you program in there. So our, social workers and nurse all have phones that they're like, checking constantly. So we would put their numbers in. For the youth who are participating in the study, they also can put this is the study team phone. So they would get in contact with the research assistant. But the idea is that when implemented into clinical care, that it would be the nurse or the social worker who's in the contact. And it would go directly to the
is there like legal name on the actual phone that you're receiving, or do you have their avatar name?
So on the phone that from what they're receiving is coming from their phone number.
Okay.
So like they would have to say who they are, or they would have to have been programmed into the case manager's phone. But our youth at this point are pretty used to texting. They might need to end up texting one day to the cell phone of one of our social workers that's being held by one of the other social workers because they're away. So they know that they're not supposed to like leave anything that's really urgent, and they know that they're not supposed to, say anything that they don't want anybody else to know, and that they'll get a call or a text back, and then they can figure out who they are at that point if they don't know.
Are there like any other healthy behaviors that you had thought about that might go along with it that you give people points for? Like, have you seen a primary care doctor, like, or things like that?
Yeah, so we didn't incorporate that into our app, just again because of the limitations of funding and time, et cetera. But there are some of the other apps that I've seen through the Adolescent Trials Network and through the social media initiative that we're part of in HRSA have like a general health score, and they'll allow them to put in information about exercise or healthy eating or substance use, and to have those things count towards this sort of points total. So I think that, you could use it to incentivize a number of different health behaviors. And in this, we were mostly targeting medication adherence and engagement in care. And we weren't specifically giving points for appointment attendance or anything like that, but we do have specific reminders in addition to medications for refills and for appointments. And so folks will know if they made it or missed it for those things.
Thank you
Thanks
so much, Nadia.